Hello everyone, my name is Dr. Phil Arnone. I'm a chiropractor. I've been practicing for 30 years. I do have a degree in functional medicine. I'm a board certified chiropractic internist, and for those of you that don't know what that means, basically it's training in modern medical diagnostics, but our approach to resolving issues is more towards looking towards the cause of disease and treating it with diet and natural medicine. The reason I've called this seminar to our attention, which I call Fearless Health, is because I think when you start talking about natural health, you need to talk about becoming fearless. So why do I call this seminar Fearless Health? You see, there are many things about healthcare that are scary, but in order to become truly healthy, you need to become fearless and understand the incredible power that your body has to get healthy and stay healthy naturally. Fear is a very common thing in healthcare because there are a lot of questions that we have, a lot of things that are really scary. As we look at that, some of these choices that we have to make throughout our lives affect our family and our kids and our parents and ourselves. What are some of these things? How do I do what's best for my family? What is causing my illness? What could happen if this gets worse? Am I doing what's right for my children? What if I don't do what they say? Oftentimes, when things don't make sense, fear is used to overcome common sense. And a lot of these things are not done maliciously. These are people's fears that are managing your conditions. And so as I talk about fearless health, my goal for you today is to gradually discover the things about health that make sense and the things that don't make sense, and for you gradually to become healthy naturally and to become fearless. So let's talk about what's fearful, because we also talk about the fact that not everything that everybody else believes is true. And see, whenever somebody uses the word, the science is settled, we should all be concerned, because the science is never settled. Throughout history, there have been times where people have believed something to be an absolute truth, only to find decades later that it was not true. But when everybody believes something to be true, it's hard to disagree with that or to believe in things that make common sense. And I say this not just from somebody that has never experienced fear, because see, my own journey started with that. You see, once upon a time, 30 years ago, I was told by a physician that I had a chronic disorder, that I would need medications that would suppress my immune system for the rest of my life. And that didn't make sense to me. And their response to that was, you absolutely need these medications, and if you do not go on these medications, you will be absolutely crippled 30 years from now. And that you would beg me to go back in time and wish that you had allowed me to put you on these medications. Do I think that that physician did that maliciously? No, of course not. Because that's their fear, that's their education. What are they taught in school? They're taught in school that the only way to manage a condition is with medication. And when faced with a significant illness, their fear for you is something that they try and impose upon you. And again, it's not malicious, they're truly worried about you. That was not my path, and fortunately for me, 32 years later, here I am. I have never taken a prescription medication in the past 35 years, nor has anyone in my family. And so when I talk about a fearless journey, I understand that oftentimes fear forces us to make decisions. But you see, these decisions sometimes affect our life drastically. Sometimes a wrong turn you can come back from, but other times you could never find your way back. What would have happened if I would have went on immunosuppressant drugs for my entire life? So again, becoming fearless is not just something you need to stay healthy, but as you continue to get healthy, you learn how to become more fearless because you understand that there are other paths that are safer and more effective. So what is my hope for you today? I wish I could tell all of you that I can give you all the answers today, but I can't. But what we can do is we can create a path. We can create a path for you to discover health, resolve your chronic conditions, get healthy naturally, and become fearless. So in order to get healthy, this is a process. We talk about health not as a line that you cross, but a path and a journey. It requires work to get there. It requires work to stay there. And we'll talk about this path today. What are those things that I need to do to stay healthy? Well, we need to talk about evaluating your chronic health, evaluating current medications, creating a plan to correct chronic illness, evaluate your habits, whether they're exercise, diet, environmental factors, evaluate your structure and gait and alignment, evaluate your plan to remain healthy, and probably more importantly, evaluate a plan for if you do get sick. Because see, when people get ill, they go into crisis mode, and crisis mode allows fear to overcome common sense. So having a plan for when you get healthy, for when you get sick. And then on top of that, organize your team. You need people to work for you to help you get healthy and to stay healthy. So the first step, let's look at the current model of health. Let's look at today's healthcare compared to the healthcare of the past. Let's look at the CDC website. And what does the CDC say about America? Well, it says that 6 in 10 Americans have at least one chronic disease, and that 4 in 10 have 2 or more chronic diseases. It claims that the great majority of these conditions are due to lifestyle factors and environmental factors. We talk about our children. 4 in 10 children now have 2 or more chronic diseases. Childhood allergies, asthma are all on the rise. Diabetes, obesity, cardiovascular disease, cancer in our adult population, all on the rise. Every single disease that you can think of increases every year. Does this make sense? Is our healthcare system working? What's scary is the fact that people have so many chronic diseases. I think that is the scariest thing out there. And so when we talk about fearless health, people are afraid of the wrong things. People are walking around with obesity, diabetes, and they're not afraid at all because someone has told them a pill will resolve their issues. But these diseases are on the rise, and fixing these things is essential to your health. So let's look at the most common medical conditions. And as we look at these 30 most common conditions that most patients seek out care for, once again, the great majority of these, 80 to 95%, depending on the condition, are due to lifestyle and environmental factors. What are the treatments for these disorders? Well, you all know the common treatments from the medical professionals: antibiotics, medications, steroids, vaccines, antihistamines, allergy shots, referral to a specialist. Modern medicine will note that there is not one single drug that addresses the cause of disease, that drugs and medications are meant to manage disease, not treat the cause of disease. That is in the medical literature. And if 85 to 90% of these diseases are caused by diet, lifestyle, and environmental factors, and none of these medications are meant to treat the cause of disease, are these the tools that you want to manage your health? These are decisions that you need to make. Does this make sense that the past decade saw a 10% increase in the number of Americans using at least one prescription medication, a 20% jump in the number of people using 2 or more? That the number of Americans using 5 or more prescription medications has increased by 70%. Does this make sense? There are all kinds of textbooks about how our modern medications are causing many of our modern diseases. What is the actual question that you need to ask yourself? Well, what tools and methods do I want to manage my health? What is my philosophy of health? And what frightens me more? So again, if we take a little closer look at some of these conditions, we can't look at all of them today, but let's just look at 3 or 4 of the modern conditions that people consult physicians for. And let's look at how those medications deal with the disease itself. We'll start with gastrointestinal disorders. Do you know that chronic gastrointestinal disorders are prevalent in almost 30% of the American population? Chronic gastrointestinal disorders are one of the major sources of immunosuppression. So if you want to be healthy, you need your gastrointestinal system to be healthy. What are some of the common disorders? Gastrointestinal reflux, irritable bowel, celiac. You can read all of them. What are the treatments? Or what are the causes of these disorders? Some of the causes of these disorders include food sensitivities, gluten intolerance, histamine intolerance, lectins, systemic yeast, dysbiosis, viral load, bad diet, alkaline acid issues, poor organic function. The list goes on. But what are the treatments? The treatments include medications. And again, we can look at this list of medications. Absolutely none of them address any of those causes that we looked at in the previous slides. And what's more concerning, we already talked about how chronic gastrointestinal disease is a major cause of immunosuppression. But those medications themselves further cause immunosuppression. And I hear this all the time from my patients, that I was looking for a natural solution to my Crohn's disease, and I was so upset with my physician because they recommended a steroid. And my response to that is, well, what do you expect? You know, you're going to a physician that their education is about medical management. It is not about treatment of the disorder. And so when they see somebody with Crohn's disease, which can be a very serious disorder as it progresses, their model is not to correct the cause of disease. That's not their education. Their model is to treat and manage the symptoms. And again, it's the wrong fit. You know, if you're asking the question, how do I resolve my problem naturally, and you're going to somebody that their tools are about managing the condition, it's a wrong fit. So think about who you're asking the question to, and if you're asking the question, don't be upset when you know what the answer is going to be. And again, do these physicians recommend steroids maliciously? No. They're fearful for you. They are fearful that if you have Crohn's disease unmanaged, it could be a very life-threatening disorder. And they need to manage it with the tools that they have. So again, it is not out of maliciousness that they give these recommendations. It is not their training to correct the cause of disease. It's about managing the disorder. Let's look at some of the diseases and some of the concerns that these medications cause. Proton pump inhibitors. These are things that people take for reflux. Long-term use cause fractures, increase your chance of pneumonia. They cause mineral deficiencies, vitamin B deficiencies, chronic kidney disease, and dementia. They also increase your chance of developing bone fractures from osteoporosis 62%. And again, what did we say? Chronic gastrointestinal disorders cause immunosuppression. The medications cause immunosuppression. If you want to be healthy, these things are not appropriate tools. What about chronic pain? Let's talk about another condition. Studies show that chronic pain rewires your immune system and your nervous system, meaning that it permanently changes how you react to things. And we know that chronic pain causes immunosuppression. What are some of the things that are used for chronic pain? Well, NSAIDs. We know that the long-term use of NSAIDs increase your risk for heart attack, documented in the medical literature. What are some other therapies? Corticosteroids. What do corticosteroids do? Well, we know that corticosteroids suppress your immune system, weaken your bones. In fact, over the course of time, corticosteroids can contribute to many disorders. Let's look at some of the ways that other physicians are managing disease, because 1 in 5 Americans, again, suffer from chronic pain. Let's talk about surgery. Look at this study in Spine Journal, that 42% of work comp injuries, if they go to an orthopedic surgeon first for pain, wind up with surgery. But if that same group goes to a chiropractor, only 1.5%. Surgery is on the rise. What about opioids? 128 people a day die from overdosing on opioids. And it is suggested that 80 to 90% of opioid addictions start with people trying to manage chronic pain. Are these the tools that you want? What about heart disease? Well, let's look at heart disease, because the CDC says almost 95% of heart disease is diet, lifestyle, and environment. What are the tools to manage heart disease? What are the treatments? Well, here comes another one of those questions that I see every day from my patients. My cholesterol was high and I was so upset because my physician keeps trying to force me to take statins. Well, if you're not managing your cholesterol, that's their job. Why are you upset with them? You know, they are worried about you. They're fearful that if your cholesterol continues to elevate, you will have a cardiovascular incident. It is not their training, it is not their tools to manage cardiovascular disease naturally. It is their training to treat the symptoms of cardiovascular disease and mitigate more complicating symptoms. Once again, it's the wrong fit. You know, if you want to fix cardiovascular disease, you need to ask the questions to the right people. You know, if you need your hair cut, you don't go to the dentist and get upset that the dentist didn't cut your hair. You need to ask the right questions. And again, this is their fear. When you go to somebody with a cardiovascular disorder, which we know is the #1 cause of death in the United States, and you have risk factors, they are fearful for you. They do not recommend statins out of malicious intent. It is not their job to correct your diet and lifestyle, but it is their job to try and mitigate serious effects. So again, you need to ask the right questions to get the right answers. And let's look at statins, because there's all kinds of questions about what statins really do anyway. You know, there's concerns that statins contribute to psychiatric disorders and depression. There's also concerns about the effectiveness of statins, which raises the new concept of fake science, that there's all kinds of journals and published articles and textbooks written about how science is changing, that once upon a day we used to observe something and then we would use science to prove it. But now we want to demonstrate that something's effective, and big companies pay people to prove that. And many studies are manipulated in the way that they're dictated to the public to show that these medications are more effective than they are. And we need to begin to ask questions. And we need to begin to ask the question, how do we get a more fair assessment, unbiased studies about what works and doesn't work? These are things as a public we should demand. So again, with the exception of emergency medicine, which we have one of the greatest systems in the country, there are no medical therapies that treat the cause of disease. So does this make sense to you? What about cold and flu? What kind of things do you do when you get cold and flu? I find so many people are fearful of these things. Well, let's look at the medical research and let's talk about when are antibiotics appropriate and when they're not appropriate. Because see, the great majority of time, the medical literature suggests that antibiotics should not be used. Yet 90%, possibly greater depending on the physician, antibiotics are used when people are sick. Yet their own literature suggests this is not appropriate. We know that 100% of viruses are immune to antibiotics. We know that studies show at least 46% of infections are viral. We know that many strains of bacteria, some estimate up to 70%, are immune to antibiotics. Yet I ask the question again, how many of you are recommended antibiotics when you get sick? It's the wrong tool, patients. Does this make sense to you? So, what about the dangers of antibiotics? How do you protect you and your family? Let's look at some of these medications and look at some of the documented research that suggests the things that you should be concerned about. There are studies. If you take multiple antibiotics over a short period of time, just a few years, your risk of cancer goes up 27 to 37%. We know that antibiotics suppress your immune system. We know that antibiotics make you more vulnerable to recurrent infection. We know that antibiotics can trigger chronic diseases like irritable bowel, rheumatoid arthritis. We can see these things when we do stool testing. We can see when autoantibodies have been triggered. We know that these antibiotics disrupt the microbiome in your gut, and we know that that is essential to health. We talk about how increased antibiotic use in children increases asthma, especially when they're used in the early stages of life. Once again, I hear this from my patients. I took my kid to the doctor, they recommended an antibiotic, I was upset. You know, why are you upset? You know, you went to your physician for answers, their tools are antibiotics. Again, you need a plan to stay healthy. You move towards antibiotics and surgery when you're in crisis, but you need to learn how to manage your health, stay healthy naturally, and become somewhat fearless so that you can mitigate the times that you need these things and hopefully eliminate them altogether. Sometimes their recommendations even conflict with their own studies. Multiple studies show that in case of ear infections, it's better to sometimes just wait and see what happens. Yet that's often not the case. Again, are these medications recommended out of maliciousness? No. This is their fear. How do medical professionals manage disease? They manage disease with medications. They're worried that if you don't take those medications, something serious can happen. That's their fear. Just like their fear for me when I was a young man that I needed drugs forever. That was their fears driving their concern, not necessarily something that made sense. So again, we already talked about how the microbiota can disrupt your health, but there's all kinds of studies that continue to come out that when the antibiotics create a disruption to the microbiome in your gut, there's psychiatric disorders that occur from that, autism, Parkinson's, Alzheimer's, schizophrenia, multiple studies that suggest these medications are contributing to or causing these diseases. You could look at those studies for yourself. They're well documented. And so if we summarize these things, we know that antibiotics increase cancer risk. They increase your risk for rheumatoid arthritis. They increase your chance for diabetes, chronic intestinal disorders. They damage ligaments. They cause recurrent infections. They cause anxiety disorders, chronic fatigue, cognitive function disorders, and depression. They increase your risk for cervical arterial dissection. They increase your risk for asthma and allergies. Folks, you need a plan to get healthy naturally. You need to get yourself to the point where your immune system does not break down enough to the point where you need these things. They are dangerous. And remember, all viruses are immune to this thing. So we look at this book. 30 years ago when I used to lecture, I talked about this book, The Coming Plague, which was written in 1990. The Coming Plague talked about how if people continue to become dependent on antibiotics, and if people continue to become dependent on vaccines to develop some sort of acquired immunity, that little by little, people's natural immunity would be suppressed. And on top of that, superviruses would start to develop. So this book, The Coming Plague, talks about how if we don't start improving our health naturally, that we would see more and more disease in the decades to come. Which brings us to where we are, looking at COVID. You know, what's happening with COVID? We have a virus that mutates. We have a new virus. And what's happening here? Is this fear or common sense? I think what's happening is the medical professionals and our government professionals are fearful, and rightfully so, because what is their approach to health? Antibiotics and vaccines. What do they have for COVID? Nothing. But again, does the fear make common sense? You know, when we look at the numbers and we look at China, one of the things that nobody's talking about is if you think about when these statistics were posted to my presentation, there were roughly 640,000 people that were tested positive in China with COVID. Yet less than 20,000 had died. And the thing is, if 600,000 people had tested positive, that means they were sick enough that they needed to be tested. And if they were sick enough that they needed to be tested, that means there were probably 600,000 to who knows how many millions that had minor symptoms that didn't even know they had COVID and they recovered. And on top of that, there's probably a whole bunch of people that got exposed to the virus that never even experienced any symptoms. But nobody's talking about those numbers. They talk about how many people are dying. And whenever people are dying, it's a crisis. And we have to respect the position of our government and healthcare officials in terms of how they're managing a crisis. But what we do need to question is, does this make sense? We already talked about the coming plague. We talked about how this has been predicted in the future. And when we look at the numbers, the CDC says that the only people that are dying, or at least the great majority of people that are dying, are those that are 80 and over, and by nature of their age are immunosuppressed, or larger groups between 60 and 80 with multiple health complications, meaning that those people are already immunosuppressed. And while it's difficult to follow the numbers because there's questions about the accuracy of the testing and who's getting tested and who's not, but at the end of the day, very few people that are truly healthy are getting sick and dying. They're getting sick and getting well. And so when we compare this to some of the other diseases, we look at the flu, and we look at the flu in the same period of time, and we had 31,000 cases with 12,000 deaths. In fact, when you look at the statistics for 2018 to 19, there were over 30 million cases of the flu and over 100,000 deaths. What about other diseases? You know, when we look at other things like H1N1, in 2009, 60 million cases of H1N1 in the United States, 12,000 deaths in the US, 284,000 deaths worldwide. What about when H1N1 came around in 1918? 675,000 deaths in the United States, 50 million deaths worldwide. We've had diseases in the past. The concept of viruses periodically coming through and causing pandemics is commonplace. It's not something that's out of normal. It's going to happen once in a while. But according to the CDC, the people that are dying are the people that are immunosuppressed or compromised. And the problem here is greater numbers of our population are immunosuppressed. And it's probably why the government and our medical physicians have gone into this lockdown mode, because we're trying to protect the people that are immunosuppressed. But does that mean that healthy people should be fearful? Not necessarily. That's not what the statistics say. Maybe fearful that you're going to contaminate somebody that is immunosuppressed. But does this make sense? What are we going to do? The real tragedy about any tragedy is if we don't take lessons away. See, I think what's really scary about what's happening right now is that we're not asking the right questions. We're not asking the questions such as, how do we increase our health? How do we improve our numbers? How do we reduce the number of people with chronic disease? And more importantly, is our current medical system working? You see, science and big pharma say that medicine and antibiotics and vaccines are the answer. But the CDC and statistics say that all disease is on the rise. Does this make sense? So what are you afraid of? You know, do you want to be one of the people that gets exposed to COVID and doesn't come down with illness? One of the people that gets exposed, gets sick and gets well? Or do you want to be one of the people that dies? My suggestion to you is you start getting yourself healthy naturally, because COVID will not be the last time we have a virus or a flu that's killed people. And let's compare it to some of the other things that are happening in the United States. Let's compare it to the number of deaths from heart disease, cancer, accidents. Heart disease, 647,000 a year. Cancer, $599,000 a year. Influenza, pneumonia, 55,600 just in the United States. Intentional self-harm, 47,000 deaths a year. That is much more than COVID. Stroke, 146,000. Alzheimer's, 121,000. Accidents, 169,000. It is always unfortunate when people are dying, and it's tragic. But the lessons we need to take away from this are, how do we begin to question our current medical model, and how do we begin to get our population healthier? So let's talk a little bit about the immunity and what happens with the immune system and how disease is meant to be fought. You see, when you come in contact with a virus, viruses can get inside your body. They're airborne. And once they get inside your body, your immune system has mechanisms to destroy that virus. You see, because the only way the virus can stay alive is by invading the cell. But your body has multiple paths to prevent that virus from getting into the cell. It has antibodies that can destroy it and say, hey, we got this covered, you're okay. Or the cell sometimes, in a process called phagocytosis, when the virus is trying to invade the cell, can fold in upon itself and seclude that virus so that it can't destroy the cell. And sometimes the body will coordinate those viruses to clump them all together so they're easily identifiable. This is what we call infected. Because when you get exposed to the virus and your antibodies are fighting it off, you're infected, but you're not sick. And you know what happens when you get infected? You develop immunity, which means the next time it comes around, your antibodies say, hey, we recognize that virus. Let's get mobilizing quick this time. That's the way immunity occurs. How else does immunity occur? What else happens with your immune system? Well, we talked about that when you get sick, what happens is the virus invades the cell. And once inside the cell, it replicates and damages the cell. But your body knows that. So your body has these T cells. And what the T cells do is they come along and they destroy those infected cells. But you know, when your body's destroying tissue, what does it do? Well, it raises the temperature. It causes a fever. You have mucus, sneezing, coughing. So we talked about how when the antibodies have this covered, you're not necessarily getting sick, but when the cells get invaded, you're getting sick. But the T cells can often destroy those cells and get rid of them if your immune system is strong. Some of those viruses have gotten really smart. That's some of the concerns about COVID. You know, it mutates, but a lot of viruses mutate. And they know how to camouflage themselves. So all of a sudden, those abnormal cells that are infected with the virus kind of look like normal cells. But your body's got that covered too. It has these NK cells, natural killer cells, and they know how to recognize short differences between abnormal cells and infected cells and destroy them. So again, what happens once your T cells and NK cells activate? You develop immunity, so the next time this comes around, that you get better faster, or sometimes you get infected and don't get sick. That's natural immunity. And so again, we talked about why is our government so concerned, why are big pharma and why are the medical professionals so concerned? Because again, they know that people don't necessarily have natural immunity to COVID. So again, what is their plan? Well, we need to develop immunity through vaccines, right? We know that that's their process. We've already talked about that. But what you need to do is you need to worry about strengthening your immunity. And what kind of things weaken your immunity? Well, let's talk about some of those things. Because these are things that make you more prone to not just getting infected and getting well, but to getting sick and not getting well because your immune system is weak. Chronic disease, antibiotics, steroid usage, antibiotics, immunosuppressant drugs, autoimmune conditions that are unmanaged, chronic pain, obesity, inflammation, chronic gastrointestinal disorders, diabetes, abnormal movement and gait, chronic stress, bad diet, poor exercise habits, chronic unmanaged stress, and fear and anxiety. Could you imagine if our healthcare professionals and our government exerted the amount of energy that they have dedicated to COVID, to getting our population healthier, to helping people determine how to correct these things that we've talked about that cause chronic weakness to our immune system? This is what we need to move towards. Again, the CDC says the people that are vulnerable to COVID are the people with these chronic diseases. The sadness of life is not necessarily that we have a virus like COVID, but that we have increasing numbers of our population that are vulnerable to death from viruses like COVID. So, since antibiotics don't work, the next line of medical defense to help you stay healthy is vaccines. But let's look at this, because once again, we talk about fear versus common sense. So to date, we've talked about some of the common diseases that people utilize medications for. We talked about heart disease, we talked about GI function, we talked about cold and flu. And we talked about, does it make sense, our approach to those disorders? Does treating the symptoms make sense to you? What are you more afraid of? Are you more afraid of the treatment? Or are you more afraid of the fact that chronic disease is being ignored? So let's look at the next stage of how things are managed in healthcare and whether they make sense. Because medicine says that vaccines improve our health and that science says this is the case. But let's look at the common sense of this. You see, when I was a young man, there were 3 vaccines, but that is not the case now. There are over 60 vaccines that people receive, and there's over 270 in development. And so we start asking the question, well, if the facts say that we're getting more unhealthy every year, and medicine has more and more drugs and more vaccines, does this make sense? Does the escalating vaccine schedule, does the escalating use of medications help us to stay healthier? Does that make sense? Science says yes. Statistics and common sense says no. And let's look at things like viruses. There are 10 to the 30th power viruses in the atmosphere. And while not all of those affect humans, that's a lot of zeros. And the question is, well, we've got 60 vaccines. Do we need 300 vaccines? How many do we need to combat all the viruses in the air? There's not enough. And what about bacteria? Trillions and trillions. I don't even know how many zeros that is. These are bacteria in the air. They say that in 1 cubic meter of air, there's over 800 million viruses. So as you swipe your hand through the air, 800 million viruses. All things that your immune system should be able to fight off. And let's talk about what the CDC says, because science says vaccines are an effective way to stay healthy, and that we use drugs and vaccines to get people well, and that we're using vaccines to try and build immunity. What is immunity? We already talked about that. Well, immunity doesn't mean you're immune to the disease. It just means that when you come in contact with it, you respond quicker. And that's the purpose of a vaccine, is to expose you to that. But again, we talked about in China, while nobody's testing everybody, there are probably millions of people that have come in contact with COVID that didn't know it, that have developed some sort of immunity. And that's what they want to do with a vaccine. And the question is, yes, the government is trying to do what they need to, and yes, Big Pharma is trying to do what they need to, and yes, Big Medicine is trying to do what they need to, but does this make sense? How many viruses are out there? How many vaccines do we need? Does common sense tell us that as the schedule is escalating, we're getting healthier? You need to be dependent upon yourself. You need to begin to take actions to get your health better naturally. And let's talk about safety, because there's also concerns about, as things escalate, what kind of dangers are out there. We already talked about the dangers of antibiotics that are well documented. There's dangers to vaccines as well. The purpose is to build immunity, but it's not as if they're without danger. The CDC lists that vaccines are unavoidably unsafe. That is their position, that vaccines are something that they have decided is moving our health forward and improving the health of our population. And there's dangers, but they're acceptable. And then let's look at the common sense. We look at Gardasil, which is one of the newest vaccines for cervical cancer. So in East Africa, where the cervical cancer rate is highest, there's only 4.27 deaths per 10,000. The Gardasil vaccine, on the other hand, 81.49 severe adverse reactions per 10,000 and 13 deaths. So we have a vaccine that's trying to offset, at worst case scenario, 4 deaths per 10,000 that's causing 13 deaths per 10,000. The question is, does this make sense? Is this malicious? No. This is their philosophy. Their model of health is more vaccines, more antibiotics. And the things we need to start questioning is, when someone tells us that something's not safe, who determines what risk is involved, and who determines your choice to determine what you're more afraid of? And again, when we look at who's managing distributing vaccines, we look at the medical physicians. And I challenge you to ask the great majority of physicians, how much education did they have in school regarding vaccines? 0. 90% have never read the inserts, which clearly outline the concerns. Many of them have never seen an insert. If you ask them if they're aware of the side effects or the concerns, oftentimes they're not. And so we need to start demanding from our medical professionals, if they're going to recommend things that are unsafe, they should at least be aware of the concerns. And we also need to start asking the question, is there a conflict of interest in some of the studies? Who is determining what the benefit is versus what's safe? Our medical institutions need to wake up. We talked about the worst thing that could happen with any tragedy is for us to not learn a lesson, We know that our medical institutions do not have much education in diet, environmental disease, exercise, vaccines, natural health. The current model of health is failing our population. I hope that all of you start to begin to recognize that some of this doesn't make sense, and that if you need to stay healthy, you need to get healthy, and you need to take charge of your chronic conditions and create a plan and organize your team. We, the people, must demand from our government and our medical professionals to start recognizing the data and looking at the common sense of health, because a lot of these things do not make sense. Many doctors have already begun to understand this. And this is why you're seeing a little bit of an upheaval among our physicians breaking away from traditional medicine. And what's more concerning is some of these people are scrutinized. And I ask you the question, when did it become villainous to ask a question? We talked about in the very beginning that there has never been a time in history where the science has been settled. But now, asking questions has become villainous. When you start questioning what's happening, the fear versus the common sense, the statistics versus what's actually happening, these physicians are criticized. And now we're dealing with a concept of fear versus freedom. Because asking the question should never be a crime, and whenever asking the question has been a crime, there have been great tragedies in history. We as the population need to be allowed to ask the question, and we need to demand our professionals ask these questions, and we need to demand this of our government. And what about Big Pharma? Can we trust Big Pharma? You see, because we're in this age of fake science, where studies are performed to prove what people want them to say. And who trusts the government these days? The government doesn't trust the government. The Democrats don't trust the Republicans don't trust the Democrats, the people don't trust the government. And do you trust Big Pharma? Well, we're dealing with a situation where people think we're in the age of information, but we are not. Google and Facebook have already admitted to censoring information, meaning that information is censored based according to sponsorship. The news does the same. Do you think the news that has 90% of Big Pharma commercials paying for their airtime, do you think they're going to not censor what's said to protect their major vendors? We are in a major time of direct information, which is directed by what people want you to see. And that's scary. And what's more concerning is some of these companies have proven over and over again not to be trustworthy. We can go on and on about the different medications that have been known to be damaging to our health. The thalidomide tragedy, the DDT situation, the SSRI cover-up, the Vioxx situation, the landmark settlement against opioids. Many of these medications, big companies knew there were major problems with issuing these to the public. Yet that information was buried. And then once it was discovered that it was buried, there were no fines levied. There were no consequences. In fact, even after these companies have continued to be proven to be untrustworthy, in 1984, it was determined that they're no longer responsible for any damages that occur from a vaccine. And they've set up a VAERS court with over $4.2 billion of settlements over the years. These companies are no longer responsible for any of the damages that occur from their medications. And so I ask the question, how do we trust companies that already have a proven track record of burying evidence, of putting big dollars and big profits before human health? How do we trust this situation? Who do you trust? Do you trust yourself? Do you trust your ability to get healthy naturally? Or do you trust the science that's out there to prove that medications are effective? We already talked about how Big Pharma is mitigating the news, but do you trust the government's ability to manage things appropriately? Big Pharma spends $27 million a year that we know of to put our elected officials in office. And while some of those people really mean well getting in, how many of you really believe that they are unaffected by the dollars that help them to get reelected? We are talking about a situation of health and fear and big pharma all at odds with one another. And you need to begin to get healthy naturally in order to protect yourself from the billion-dollar industries that are controlling healthcare. So again, I ask you, is this the philosophy you want? As we begin to talk about natural health, you need to decide, are these the tools that are right for you? Are these the tools that you're going to use in crisis, or are these the tools that you're going to use in everyday life? We talked about that one wrong turn can sometimes alter your health. We've talked about how these medications have side effects. And while no one is recommending them maliciously to you, you need to prepare yourself to take care of yourself before you ask the question about what medication I need. So let's talk about what you're going to do. Are you going to be healthy, or are you going to follow the current model of health? If none of these things have made sense to you, then the medical model of health is probably for you. But if these things make sense, you need to begin to create your plan. The best model of health is a strong immune system. And in order to have a strong immune system, you need to get healthy and become fearless. And again, we talked about in the very beginning that that is not a line that you cross. It's a process, and your immune system needs to be exercised. And the process of getting healthy is a process of daily change and activities. So how do you stay healthy naturally? We talked about the first two stages: evaluate your philosophy and educate yourself. The reason I spent so much time going through the statistics of healthcare is you need to begin to make sense of this, and you need to decide what makes sense to you. But again, once you've decided that it makes sense and you want to go down the journey of getting healthy naturally, these are the other things you need to do. Evaluate your current health. Evaluate your current medications. Create that plan to correct chronic illness. Evaluate exercise, stress, nutritional habits. Evaluate your structural alignment and gait. Evaluate environmental challenges. Create a plan to remain healthy. Create a plan to deal with sickness, and organize your team. So let's start with step 3. Evaluate your current health. This should be easy. Get out a pad and paper. Get out a computer. Make a list. Determine what chronic diseases you have and start searching for someone to help you resolve those conditions. You remember we talked about chronic disease is one of the most critical things that weakens your immune system. If you want to get healthy naturally, you need to reduce the things that damage your immune system. Chronic disease. Remember what we talked about, fear versus common sense, what weakens immunity. We talked about the various autoimmune diseases, the various medications, the various disorders. You need to begin to make your list and create a plan to eliminate the cause of disease. Remember the CDC said 6 in 10 Americans have one chronic disease. 4 in 10 have 2 or more. Who do you want to be? One of the people without chronic disease, or one of the people with chronic disease? One of the people with autoimmunity and immunosuppression, or one of the people with a strong immune system? Choose a strong immune system, please. Step 4, what medications are you taking? We've already talked about how chronic diseases can weaken immunity, but the medications themselves often weaken immunity as well. So how do you create a plan to safely get off some of the medications you're on? Well, it starts with fixing chronic disease. Do you want to be one of the many Americans taking multiple medications a day, or do you want to start treating and discovering the cause of your illness? Step 5, let's start creating a plan to correct these chronic illnesses. Who can you reach out to? Is it a medical physician? Is it a chiropractor, a naturopath, a homeopath? Is it self-help? These are the things that you need to find out for yourself. What about step 6? Well, you need to begin to evaluate some of the things that damage yourself other than just chronic disease, because sometimes it's just bad dietary habits. Sometimes it's poor exercise habits. What about your stress levels? How do you address these things in your life that we know contribute to weakening your immunity? And again, we talk about how do you do things that strengthen your immunity. Are you going to start increasing your exercise habits? Are you going to improve your sleep? How about your attitude? We already talked about that fear and anxiety are one of the two things that weaken your immune system most. How many people have recently been undergoing immense anxiety because of what's happening with a virus? Weakens your immune system. Good foods, fruit and vegetables, various nutritional products can strengthen your immunity. And what else? Acquired immunity. See, as you come in contact with a virus and you get used to it, you strengthen your ability to fight it the next time around. If you take an antibiotic to kill that and it weakens your immune system and it kills the bacteria, you don't develop the same sort of immunity to that bacteria. Step 7, environmental factors. We all know that there are other factors that contribute to ill health, and we can go through the various toxins. But what I find interesting is so many people are worried about the things in their soap, but they're taking 12 medications a day. You need to start looking at the common sense of things. Yes, we have environmental factor problems, and if you need help with those, there's lots of tests that can be done to identify what things are present in your particular situation. But look at the common sense of things. There are plenty of things that people are doing that are far more dangerous than environmental factors. And what about your gait and alignment? When you see people walking down the street like this, that's not healthy. We know that pain and misalignment cause inflammation, and that inflammation causes destruction to the bone and advanced arthritis. We know that that inflammation damages the nociceptors, which causes damage to the nervous system, which weakens immunity. We already talked about that chronic pain weakens immunity. So start looking at your posture and start looking at your movement patterns and your sitting patterns at work and start making corrections or get help for those things. So I'm asking all of you to start evaluating your plan to get healthy and remain healthy and start talking about what's going to be your first step. And again, we talked about preparing for illness, right? The best way not to get sick, or the best way when you get sick to get well, is to start preparing in advance by taking care of the things that weaken your immune system. But you need a plan as well for if you do get sick so you don't go into crisis, so you don't ask the wrong question from the wrong person if you don't want that answer. So get a plan for what are you going to do when you're going to get sick. What options do you have? What products might I take? Who's going to help me with that? You need the plan for getting sick. And your final step is to organize your team. And you need to be the manager of your team. You don't need to be one of the players on your team. You need to manage and coordinate what the people that are helping you are doing for you. You need to direct them what you want and get the help that you need to fix the things that you need to fix so that you can be healthier. And again, you need to ask those questions of the right person. You don't ask the landscaper to come in your house and fix the toilet. So decide what you need and ask the right questions from the right people. And so ask yourself these questions as we conclude. Do you want to be one of the millions of people that is going to survive viral outbreaks? Or do you want to be one of the people that is going to succumb to death and illness? Do you want to be one of the 4 Americans with an autoimmune disorder? What do you want for your children? Do you want your children to be one of the 20% of kids with chronic disorders? What is your plan? How are you going to stay healthy? Do you want to be one of the 70% increasing prescription drugs every year? You need to take the first step. We talked about all the different steps. We went through what you need to do to be healthy. And gradually as this happens, you can get healthier with each decade instead of being one of the many Americans getting weaker and immunosuppressed every year. And if you make the right steps, you can become fearless and you can be healthy. Thank you very much for watching our presentation today. I'm Dr. Phil Arnone at the Balanced Body Center.